You know, when we look at the healthcare in total in Kenya currently, I will say we are doing poorly.
Kenya may have a long way to go in improving the health sector. According to experts, the percentage of funding allocated to the Ministry of Health compared to the entire national budget does not reach the appropriate level.
Kenya is a party to the Abuja Declaration on Healthcare, which decrees that 15% of the overall GDP should be part of the health. But up to last year, I think it was less than 7%.
For example, 90 billion shillings was allocated to the Ministry of Health in the 2018-2019 financial year, equivalent to 5.1% of the national budget. This increased to 5.5% in the 2019-2020 financial year, equivalent to 115.6 billion shillings. In the current financial year, 2020-2021, 6.5% of the 2.91 trillion shillings national budget was allocated to the Ministry of Health.
Healthcare takes the biggest chunk of the budget.
KMPDU Secretary General Davji Bamji, however, denies the efficient use of these funds and points an accusing finger at county governments.
Mostly they do what you call the political optics, where you build a structure that is seen like the one we have in Kirinyaga, and even like those ones we have in Laikipia, where the very good hospitals have been built up. But in those hospitals, there are no human resource, there are no doctors, there are no nurses, there are no even laboratory technicians to actually handle the patients. In the last about 1 or 2 years, in the whole country, less than 1,000 or less than 300 doctors have been employed, apart from Nairobi County that's employed en masse.
The question that begs is where the money needed to recruit, pay doctors, and improve services for Kenyans go to.
Some countries will divert this money for salaries into other activities, and this makes it difficult for them to sort out the employees. It has become a very big problem, and one of the biggest counties that is a victim to this currently, as we speak, is Murang'a County and Taita Taveta, and many other counties.
The challenges have since taken a new turn due to the COVID-19 pandemic.
We have the pandemic that has been ongoing, and this year we have the vaccine that has come up. So for the country, or for the Kenyans to have an access to vaccine, for the Kenyans to have access to healthcare generally, then the budget has to actually increase in the healthcare system. If they set aside about 10 billion for the vaccine only, that is, we expect to have enough doses for the country. To have about 70% access will be good enough for the society and for the country.
In the year 2018, the Universal Health Coverage Program was formulated with the aim of achieving the dream of improving quality service delivery to Kenyans. Bamji points out that devolution of the health sector could be a barrier to achieving UHC actualization.
If you look at the universal health coverage, in many counties it has not picked up and it has not taken place as required, because these counties are not employed, these counties have not started up hospitals. But when you look at Nairobi, when it is not under the governor, but it's now under NMS, which is directly in the office of the president, in the last 1 year we have seen more than 24 facilities coming up. We have seen more than 200 doctors employed.
Residents of Machakos County, however, one of the regions that piloted the program, are of a different opinion.
Watu wamekuwa wakihudumiwa. Kuna vitu vimekuwa vikifanyika katika Machakos County kama mambo ya screening za mambo ya kansa.
Kulikuwa guzuri, ukienda hospitali ukatibiwa bure, ukapimwa bure na ukapatiwa mandawa.
On behalf of doctors and the entire health workers community, KMPDU is now proposing that 150 billion shillings out of the estimated 3.6 trillion be allocated to the health sector, so as to strengthen services for citizens.
Jambo ningeomba liongezewe katika government ya Universal Health Care katika county yetu ya Machakos ni mpango wa madawa, kwa sababu isije ikawa kuna Universal Health Care ni iko tu ile wanaita matibabu ya bure, yani ile bure kabisa ambayo kwamba haina faida. Tunataka waongezee kuweze kuwa na madawa, kwa sababu mtu anapoenda pale akipimwa, amepimwa bure kweli, aweze kupata matibabu, aweze kupata madawa.
Ben Kerera, K24 Evening Edition.